Hi friends. So in this video we will be briefly covering on the other aspects of dental amalgam, which is also an important part. So let's see. First let us see some of the pictures we have here. So here we can see a clinician carving the dental amalgam restoration. So carving is done just to replicate an analog of the anatomy of the tooth. So it's done towards the tooth margins, and excess restorative material is removed. Here we can see a well carved dental amalgam restoration, and here we are able to see a clinician burnishing the dental amalgam restoration. So burnishing has two types, that is pre-carve and post-carve burnishing. I will tell you. So we are going to see in detail about each of the topics in detail in some more minutes. So this is Magler's scale, DB Magler's marginal fracture rating system. So this is on the marginal defects of amalgam. So we have a polishing kit for dental amalgam restoration. Here we have various kinds of burrs, cups, and then we have metallic burrs are there available, but not much used. So here we can see a clinician trying to polish the finished dental amalgam restoration. So as I told in the previous video, finishing and polishing should be done after 24 hours of dental amalgam restoration. Here we can see the polishing kit of dental amalgam restoration. So here we are going to see about the important relevant key points in dental amalgam restoration. So here we have the ADA specification number of dental amalgam is 1. That is the first number given by the American Dental Association. American Dental Association. The amalgam restoration should not expand or contract beyond 20 micrometers. If it does, it may affect the quality of the restoration. So here we have an important point, that is delayed expansion, which is very commonly faced in dental amalgam restorations. Delayed expansion of dental amalgam occurs when there is moisture contamination during the gamma phase formation. 400 micrometers. So delayed expansion, if it does occur, it can go up to 400 micrometers per centimeter after 3 to 4 days of restoration. So this occurs due to the hydrogen gas formation. So that kind of the hydrogen gas accumulates and it leads to the expansion of amalgam, which is beyond the restoration, that leads to pain, sensitivity, and protrusion of the restoration outside the teeth. so which may create high points. High points is when there is a restoration properly contoured in the teeth. When it has to be ideally like this, but when it goes a little bit higher, it's called high point. So which affects the occlusion, that is the mastication of the oral cavity is affected. So there is another identity called mercuroscopic expansion when the gamma 2 phase, that is the weakest phase, tin mercury and the silver tin, that is the gamma phase, which is the strongest phase, meet. That leads to the mercuroscopic expansion. Pain immediately after the restoration is due to high points, which I explained before, or fracture of the tooth. So sometimes what happens is, due to the high points, during the mastication, the pressure sometimes goes on the tooth, not always. Sometimes it goes on the tooth and the tooth fractures. If there is restoration like that, the tooth may fracture this side or this side and it may lead to pain. Fracture means not, it doesn't completely fracture, it may be a crack, and then it may lead to pain immediately after restoration. If it's after 3 to 4 days, then it's due to delayed expansion. Immediately after restoration, it's due to high points or fracture of the tooth. So delayed expansion can be prevented by avoiding moisture contamination. Compressive strength of amalgam should be minimum of 310 megapascals. At the same time, tensile strength is a bit lower, that is 48 to 70 megapascals. So these should be mentioned in the examination. Amalgam is generally of good compressive strength, but tensile strength is a little bit lower. So that is the problem with the amalgam restoration. Cavo-surface angle for amalgam restoration is a butt joint, that is 90 degrees, whereas in inlays and onlays generally we give a cavo-surface angle of a bevel, because there, as we have seen in the previous videos, that there will be good burnishability, so that there will be good retention, so that is required for cast restorations. Whereas in amalgam restoration, so bevels are usually not indicated, it has to be 90 degrees. So here the cavo surface angle is why 90 degree, because the compressive strength of amalgam is better, so that if it's 90 degree also, it can deal with the compressive forces, whereas the tensile force, it has weak tensile strength, so that it may the restoration may break, it may fracture due to tensile forces, so that it's not the cavity is not given a bevel, the cavity is of a 90 degree butt joint, the cavity preparation. So first of all, tensile strength is, for example, this is a material, so when the forces acts away from the material, it is tensile stress or tensile force, whereas compressive stresses or compressive forces, when if this is a material, the forces are acting towards the material, it's called a compressive force. Compressive forces are better resisted by the amalgam than the tensile forces. Increased trituration time, when let's keep, like a dentist is keeping on, is just doing the trituration beyond the time limit, what happens is the working and setting time shortens. So he has to urge and finish the restoration faster, otherwise it's going to set the setting time is going to reduce. So there are two types of setting times, that is initial and final. So within the initial time, ideally the restoration has to be done. Initial setting time is around 7 to 10 minutes, whereas final setting time is 24 hours. Condensation force is inversely proportional to the diameter of square of the nib. Nib is serrated. Serrated is something like this. Serrations are given. So they are speaking about the condenser. Condenser is very important instrument where it's like this shaped. There are two types. One is parallelogram and we have a cylindrical condenser. So whenever the diameter of the nib reduces, the condensation force is going to increase, whereas when the diameter is increased, the condensation force is going to decrease. That is, it decreases 2 times, that is square. So it decreases 2 times. So carving is done, as I told, to simulate the anatomy of the restoration. Burnishing is to remove the irregularity in the restoration. So some kind of ups and downs may be there in the restoration, which are removed by the burnishing. So before carving, if the burnishing is done, it is pre-carve burnishing. So after carving, it is post-carve burnishing. Before carving, it's majorly to remove the excess material, but whereas after the carving, it's majorly on the ups and downs are removed, and we get a good polished surface. So after the ideal finishing and polishing, we get a silvery white looking silver amalgam restoration. Finishing and polishing is done after 24 hours. So rubber cup should be tipped towards the margins of prepared surface. Let's consider like this restoration. So the rubber cups are like this, placed and towards the margins of prepared tooth surface. It's inclined and it's polished. 50 grams of mercury vapors in the air in the clinic is the allowed occupational exposure. Anything beyond that is not allowed. So primary risks of amalgam, many of us may think that the swallowing of amalgam from the mercury from the restoration, but it is not that. It's the due to inhalation of mercury vapors is the major primary risk. And then due to the amalgam, most common complication is contact dermatitis or type 4 dermatitis, which is also called Combs hypersensitivity, which occurs in the skin. When the amalgam touches the skin, it may lead to contact dermatitis or type 4 hypersensitivity reaction. It's a rash like type, so which is commonly seen in the tuberculin test, which is an typical example of type 4 hypersensitivity. So the last final point is Magler scale, dB Magler, which I explained before. That is, it indicates the marginal defects. Basically they are nothing but photographs taken in photographs of the restoration which are taken. So they are given various scores from 1 to 11. All the odd numbers represent marginal ditching. Marginal ditching is something if there is teeth like that and there is caries in proximal surface of the tooth, So we are going to restore it here. But what happens is, in amalgam most commonly marginal defect occurs. So if in case if there is no proper adaptation of the marginal bands, what happens is there may be a marginal ditching here. So this may lead to accumulation of calculus. It may also lead to secondary carries, marginal leakage and secondary carries. So that indicates the odd number, that is indicated by the odd numbers. So it goes on increasing from 1 to 11. That means 1 is the least affected and 11 is the very highly marginal ditched tooth. The even numbers represent the images 2, 4, 6 and 10. I hope you understood the video. Let me know if you have any doubts in the comment section. Thank you.